To all of my new friends at the Indian Society of Anesthesiologists, Thrissur City branch, I would like to offer my sincere thanks for the opportunity to share with you about the SAM, the Screenless Anesthesia Monitor. I'm Paul Barton, a fellow anesthesiologist and inventor of the SAM device. I have been identified by your colleagues at the Indian Society of Anesthesiologists through our connection at the 17th Annual World Congress of Anesthesiologists meeting. The SAM device won the 2019 Innovation in Anesthesia Award sponsored by the WFSA and Fresenius Kabi. Through this award, my development team and I have advanced the SAM device from the proof of concept stage to a working prototype that we now seek to further develop. I'll begin my talk with the worldwide need for such a patient vital signs monitor and how this manifested itself in my context, leading to the genesis of the SAM project. Next, I'll detail its functionality, and finally, I'll outline the future goals of this project. Today, around the world, 5 billion people, that's 5 out of every 7 people, don't have access to safe, affordable surgical care, says the G4 Alliance. In most low and middle income countries, access to safe, affordable surgical care, when needed, remains out of the reach for over 90% of the population, says the Lancet's Commission on Global Surgery. And finally, of the annual 250 million surgical procedures done, merely 4% occur amongst the world's poorest, 1/3. So lack of adequate patient monitoring accounts for a significant portion of this discrepancy. To show you how this manifested itself in my context, please watch this brief video introducing the genesis of the SAM project.
And so I spent about 6 years in Ecuador, and so many of the days were frustrating to me because the anesthesia equipment that we had was old or at the end of its life. I spent a lot of my time fixing and sending things out. Was struck by the idea, well, what if we had a monitor that was easy to transport, easy to update, easy to own for the practitioner, and that was the genesis of the SAM project.
Anesthetic-related mortality in the poorest 1/3 of the world's population has been observed to be as frequent as 1 in 150 patients, approximately 800 times that of the developed world. The vast majority of these deaths are preventable using standard patient monitoring equipment, ubiquitous in high-income countries. We started by asking, what technology do citizens of low and middle-income countries already have, if any? The answer quickly became obvious: a smartphone. Even the most basic smartphone has computing power and display capability to function as the core processing and display unit for a patient vital signs monitor. From there, we developed SAM. SAM is a highly portable, robust, and affordable device that, when paired with the user's smartphone running our SAM app, becomes a patient vital signs monitor, ready to combat core risks to the lives of millions undergoing surgical procedures around the world.
It's technology that we already have, but the exciting thing is rolling it into a package that's portable and able to get out into any place in the world easily. You can put this in your backpack. You can put it in a purse, and it's easy to take wherever you might find yourself. My hope is that it would be approximately $250 to $300 US. In comparison, an anesthesia or a general patient monitor is in the $5,000 to $10,000 range. Not to mention the size and getting it to the location that it's needed. is also prohibitive.
The cost is a big deal. If you're trying to be an anesthesiologist or an anesthesia provider, and it's either spending thousands of dollars on something or spending a few $100s, right? I mean, that can potentially be a deal breaker. And then, so in the context of a limited use environment, if you're a provider, working remotely in a poorer area, you can actually afford to just purchase it on your own and provide care in those environments.
Benefits of SAM reach far beyond the operating room. Patient care will be streamlined and even enhanced for paramedics, firefighters, first responders, disaster relief workers, battlefield and military personnel, home health caretakers, and any individual who seeks personal medical monitoring.
It's also easier to carry around. If you have this smaller device with your patient and you have your phone, have it set up, it's much easier to move around with, and the portability of it. It would be super helpful having that, because this larger monitor, it's nice, it's really nice, but most of the time, because of the price point of it, it's only departments that have ambulances that usually keep them. A lot of departments that don't run their own ambulance service, it's usually a really big cost that's not worth having.
We hope to develop this particular monitor at least to another level, another iteration of it, where it's even smaller and it's ready to produce. And that can happen in the course of months to several years. It should be ready to be put on the shelves and sold to whoever would want to purchase it.
As you can see, the need for such a device came from my own experience serving as an anesthesiologist in Ecuador. As a follower of Christ, I am compelled to serve and do good with the talents and opportunities afforded to me. This has been borne out in my passion to reduce anesthesia-related morbidity and mortality by improving patient monitoring during anesthesia. I frequently found safety in patient care challenging in the realm of anesthesia, and even as a general medical practitioner, due to the lack of adequate patient vital signs monitoring equipment. This equipment is readily available and the standard of care in resource-rich environments, such as the ones where I trained and worked in the United States. However, in the resource-limited environment of a mission hospital, I frequently fought to maintain even the minimum standards of patient monitoring care. Equipment was frequently broken, out of calibration, or simply absent due to cost, availability, or transportability. I would imagine you also have experienced this frustration of not being able to care for your patients as carefully as you would like due to the lack of technological resources, especially knowing that the technology exists, but is not readily at your fingertips. Speaking of fingertips, while serving as an anesthesiologist in Ecuador, one thing I could get my hands on were fingertip pulse oximeters. As an experiment, I purchased a supply while in the United States from an online retailer for about $30 US each. To my amazement, nurses, medical students, and doctors were eager to purchase these, and I quickly sold them all. This was motivated, I believe, in part by a desire to enhance the care of their patients. This experiment of ownership of your own medical equipment, such as with the ownership of your own stethoscope, and now with the ownership of a fingertip pulse oximeter, was pointing me towards a hypothesis that equipment, when offered at an affordable price, might be purchased, owned, and maintained by the practitioners themselves. Implicit in ownership is the impetus for continued maintenance and actual use of such equipment in the daily practice of medicine. It was through this experience that I began to dream of ways to make this a reality for the entire suite of parameters used in the operating room or theater by the anesthesia provider. Several years later, I outlined the idea of the SAM to the leaders in what would become later my current development team. The goal would be to produce an affordable patient monitor, which sensed the parameters of pulse, oximetry, blood pressure, EKG, and capnography in a robust, portable package. Central to its ability to be purchased and owned would be to leverage the computing power and display of a smartphone already in everyone's pocket. As you have seen, the SAM device is a small unit about the size of a paperback novel that is connected to a patient and gathers raw vital signs signals wirelessly. The SAM then transmits these users' information and signals to the smartphone. Within the smartphone, the signals are processed and displayed to the provider to use clinically. Therefore, it is my hope to further develop the SAM to a price point reachable by healthcare providers in low and middle income settings to provide patient care and save lives in the operating theaters, clinical critical care settings, and clinics worldwide. The SAM device can also be an integral adjunct to disaster response teams, emergency response personnel, military and battlefield medical providers, and even telemedicine. Layered and embedded within the SAM's core functionalities is its connectedness with vital signs data, as well as other clinical parameters from each patient encounter, can be stored at the provider's discretion, of course, in the smartphone, and then transmitted to our cloud-based infrastructure. In this information can either be used in real time or stored and uploaded to the cloud whenever the device is in the range of a cell or data connection. Information sent to the cloud can be used in real time for telemedicine interactions, and/or data can be stored and later mined for big data research and statistical investigations. Each SAM device, thus, could be a node on the worldwide internet of things. SAM currently is at the prototype version 3.0 level, and we seek funding for development partners to move this device through its next steps. These include additional field testing in resource-limited settings, FDA certification and the like worldwide, further development and testing of cloud-based functionality, optimizing markets and production details, and finally, conquering distribution hurdles. I hope you've enjoyed this brief overview of the SAM device, the Screenless Anesthesia Monitor. I greatly appreciate your interest, and it has been a pleasure to describe it to you. For those of you who would like further information and would like to contact me, my information is on the following slide. Thank you very much.